Okay, so this PowerPoint is going to show you about gastrointestinal interventions. And again, this is in general for anything that's GI related. As we talk in class, we will learn more about the specific interventions that apply. So, for gastrointestinal interventions or interventions that go with the GI system, you need to remember the word gastro. And if we look at the G part of gastro, that's to look at the GI function. So you're going to note the amount, color, smell, consistency of any output that a patient has that's with the GI system. So you're going to look for emesis, diarrhea, bleeding, drainage from tubes. You need to record the amount, the color, the smell. Okay, you need to note if it's massive, what's coming from an NG tube, what's coming from the other way. Okay, the GI function care will depend on what assessments you have made. If the client has nausea, vomiting, and/or diarrhea, the care will focus on maintaining fluid and electrolyte balance. The GI assessment is imperative to monitor and trend due to the risk of electrolyte imbalance. So go back to the other one that we talked about and remember the word abdomen for the assessment. But for the interventions, it's gastro. And G, you're going to look at whatever's coming out to decide what you need to do. The A part of gastro is to assess pain relief and provide for a comfortable position. Note if pain is relieved with food, pain medications. What pain medication do you need to withhold due to a diagnosis, because pain medication may mask symptoms or hinder the diagnosis process. Provide comfort with positioning. Use diversional activities until pain medication can be given. And then a client that is in pain does not heal as quickly, and they tend to not take deep breaths because of the pain. They also may not be able to assume a position that will expand the diaphragm. Because of pain, the client may be reluctant to sit up or to ambulate, which can also lead to a decrease in oxygenation. The limited deep breathing can lead to atelectasis and put a client at risk for infection. This makes pain management very important in the care of a client to avoid potential complications. So A is to assess pain. The S part of gastro is to sustain and/or enhance their nutrition. Okay. So you may need to give oral supplements, you may need to give vitamins, you may need to put feeding tubes in, give TPN. Okay. To sustain and/or enhance nutrition is essential for the GI client. Although the client may be NPO, the nurse is often the leader with the healthcare team that ensures the client's nutritional needs are met. The client at a minimum needs IV fluids if they're NPO or is experiencing severe vomiting and diarrhea. Nutritional supplements such as tube feedings, TPN, oral supplements, vitamins, albumin, protein are needed if they have a prolonged NPO status. So it's important for the nurse to help coordinate with the interdisciplinary team, specifically maybe using a dietitian to do a comprehensive nutritional exam. The T part is to teach the client about medications, diet, maybe available vaccines, and to teach them about ambulation to promote oxygenation and aid in healing. So you need to teach GI clients about diet and medication, i.e. when meds should be taken, with or before or after meals, what are some drug-drug interactions they may experience, and what are side effects that they need to report. Medications like antacids must be taken 1 to 3 hours after meals and cannot be taken within 1 to 2 hours of other medications. You also need to instruct about the need for activity to promote oxygenation, increase peristalsis, and help with pain management. The R part of gastro is to review the I's and O's, daily weights, labs, and diagnostic procedures, and to compare and contrast and trend any findings that you may note. By reviewing eyes and O's and daily weights for GI patients is critical, particularly with GI patients who are vomiting and have diarrhea. Clients who have tubes, drains, ileostomies, or procedures like paracentesis of the abdomen require measurement of the amount of fluid, color, and odor documented so adequate intake is given to replace the fluid loss so fluid balance is maintained. And finally, the O part of gastro is to observe, compare and contrast vital signs, labs, abdominal girth, and bowel sounds, and report a change in anything or absent bowel sounds. Observe, compare, and contrast vital signs, lab values, daily weights. Increased heart rate, respiratory rate, or decrease in BP and/or hemoglobin or hematocrit may indicate bleeding or hypovolemia. Increased WBC may indicate an infection. Decreased albumin and protein may indicate nutritional deficits and/or potential for third spacing. Elevated liver enzymes can indicate involvement of the liver. Trending abdominal girth and bowel sounds provides information about the intestinal tract function and recognition of potential complications.